Health officials do say more vaccinated Americans will experience these breakthrough cases, but tonight there is a new study showing that could actually lead to more protection. In fact, they're calling this super immunity. Dr. Marcel Curlin is an infectious disease doctor who worked on this study at Oregon Health and Sciences University and is joining us live tonight. So, doctor, take us through your research and define super immunity.
Marty, thanks for having me. Sure. So essentially what we did was we looked at the immune responses in people who got vaccinated, fully vaccinated, compared with those who got vaccinated and then got a breakthrough infection. And the first thing to notice is that all the breakthrough infections were mild. But the next thing that was really interesting is that the immune responses in those who had breakthrough infection were astronomically larger, greater than the immune response of those who were just vaccinated alone. And the third thing is that those immune responses are not only larger, but they're much more able to neutralize a variety of variants. So I think that those are really significant results because it speaks to the likely protection that we're going to have in the future from this scenario.
So just to be clear, people who have received both doses of the vaccine, then contracted the virus, so had the breakthrough infection, saw this super immunity. Do you have any idea how long it lasts? Are we there yet?
No, we don't know that yet. There just hasn't been time to study it longitudinally. But there is the idea that immune responses, even if they wane, which is a natural phenomenon, all of our immune antibody responses, they'll wane over time. But we are left with a memory of that previous infection, which allows us to then very quickly mount a mature response like you had before. So the protection will likely be long-lived in some way.
It's really interesting what the science is revealing about this virus right now. Doctor, are you concerned, though, that people hearing this may become more lax in the steps that they're taking to protect themselves if they think, I've got the vaccine, I'm boosted, if I get it, I may even be okay?
Yeah, well, I would say a few things. We've had a number of questions like this. Number one, nothing in our data say that you shouldn't get vaccinated. It's the combination of vaccine plus natural infection afterwards that seems to be so unique. Number two, you really don't, some people say, well, should I just try and get COVID then so I get immune? You would never want to get COVID to avoid getting COVID. That doesn't make sense. And so really what the advice we're saying is to everyone, get vaccinated, get boosted. And finally, COVID, whether it's Omicron or some other variant, it's still COVID. It spreads the way COVID does. And so wearing masks is a fundamental part of protection. It works. It's very effective when done properly, and everyone should do that.
Let me ask you, while I've got you here, about this antiviral pill from Pfizer. Could this be a game changer, as many think it may?
Some people feel that pill is going to help, particularly for those who are really at risk for severe disease. That would be the elderly or individuals who have comorbidities like diabetes and hypertension, who are likely to go on to really severe disease. They would be the ones I think that would benefit the most from this. Of course, it's downstream, and really prevention is better than cure if you can at all achieve it, but it may be a lifeline for those people that unfortunately get infected and then go on to be really sick.
Before I let you go, Doctor, this week, Dr. Anthony Fauci said he doesn't think it is possible that we eradicate COVID. Can you paint a picture for us of what the years to come may look like, medically speaking? Are we getting yearly shots? How long are we still wearing masks?
Dr. Fauci is probably correct. COVID will be with us for the long haul. But what is going to change, I think, and what the data that we're seeing speaks to, is that we're going to have a worldwide population that is much more able to cope with COVID infection. And so ultimately what that means is that while infections may occur, the severity and the social disruption will decline rapidly from pandemic to more endemic. And that means something like influenza. We still have influenza around, we get vaccinated, but we can live normal lives despite the fact that influenza is going on. And I think that that's where we're headed ultimately with the SARS-CoV-2 epidemic.
And it for the long haul. Really fascinating research. Appreciate what you and your team are doing. Dr. Curlin, thanks for your time.
Thanks, Marnie.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.